The following Ardelyx podcast is intended for informational and educational purposes only and cannot be considered as medical advice. Please speak to a healthcare professional before making any treatment decisions.
Hi, everyone. Welcome to another Gut Matters podcast episode. I'm Johanna Ruddy, Senior Director of Patient Advocacy at Ardelyx, and I'm joined today by my co-host, Dr. Andrea Shin, practicing gastroenterologist at UCLA. And today we are excited for this special episode for June and for Pride Month. And we're calling it today Embrace the Rainbow, Digestive Health in the LGBTQIA plus community. And I'm so excited to welcome our guest speaker on this podcast. I shouldn't say speaker, our guest conversationalist and expert, and that is Dr. Ardelyx Goldowsky. Dr. Ardelyx Goldowsky is a gastroenterologist at Beth Israel Deaconess Medical Center and instructor of medicine at Harvard Medical School. He completed his internal medicine residency at Beth Israel and his gastroenterology fellowship at Boston Medical Center, Boston University School of Medicine. His academic interests are focused on general gastroenterology, functional GI disorders, disorders of gut-brain interaction like IBS, with an emphasis on digestive health in the LGBTQIA plus community. He has a passion for medical education and improving trainee and provider knowledge of LGBTQIA plus digestive health topics. And he's also the director of the Center for LGBTQIA plus digestive health at Beth Israel Deaconess Medical Center, which I'm excited to dig into and learn more about. He is also a founding member of Rainbows in Gastro, which is the affinity group for LGBTQIA plus gastroenterology and hepatology providers and allies, where he serves as the treasurer. His accolades go on and on with publications and talks that he's given. I think you're going to see how special he is. So welcome, Ardelyx. So glad to have you.
Johanna, thank you so much for the kind introduction. Great to be with you and Andrea on this podcast episode.
Yeah, thank you so much for joining us today, Ardelyx. It's really a treat to have you here. I want to start off today's conversation by talking about this concept of minority stress in health. I'm sure you know a little bit about that. And so, I'll just kind of get right into it. My first question for you, could you start by just explaining this concept? What is minority stress, how it impacts, physical, mental health of individuals, particularly who are members of the LGBTQIA plus community?
Absolutely. I think it's a great starting off point. So the way that I think about the minority stress model is that it's just one way of thinking about why minority groups experience healthcare disparities or inequities. So in this model, a minority group is going to experience mistreatment, stigma, discrimination, and within the LGBTQIA plus community, I also like to point out the idea of concealing one's identity. So the idea of having to come out of the closet is just another aspect of that stress that they are undergoing. And with this increased stress, along with behavioral health factors, environmental factors, this ultimately leads to negative healthcare outcomes. Some of the ones that people might think about more commonly are things like depression, anxiety, increased rates of suicidality and self-harm, substance use disorder. But within the GI world, we're also thinking about whether this might impact things like disorders of gut-brain interaction, so irritable bowel syndrome, whether it may lead to increased rates of obesity and increased rates of metabolic-associated steatotic liver disease. The list kind of goes on, but it's really that underpinning of a minority group experiencing significant stress more than we would expect.
At Ardelyx, we're dedicated to improving the lives of patients by discovering, developing, and commercializing first-in-class medicines that advance care to patients with unmet medical needs. Learn more about us at ardelyx.com.
I'm curious if this minority stress model was one of the many reasons, I'm sure there are many, for you advocating for the Center for LGBTQIA plus Digestive Health at Beth Israel Deaconess Medical Center, and really, seeing the impact of the minority stressors that you just outlined in the patients within this community, and recognizing that they needed more specialized care.
It's something that I think about a lot. When I went into gastroenterology, I'm going to be honest, this was not something that was necessarily on my radar, but as I went through my training and really found my passion for this, I think ultimately what I've learned in caring for my patients is, particularly my LGBTQIA plus patients, they've experienced so much discrimination, so much stigma, being kind of told off, being told, oh, it's just in your head, being asked inappropriate questions, things like that. So for me, using our Center of Excellence as a means to give both culturally competent and culturally humble care, and really just saying, hey, I see you as a person, I want to take care of you, and I want to make sure that you feel heard and that your concerns are being addressed and not being pushed off to the side just because you're a part of the LGBTQIA plus community. So yes, It 100% plays a role in that.
Yeah. I just think it would be great for our listeners who maybe are unfamiliar with some of the terminology that we're going to be using today. Alex, would you mind just kind of decoding the alphabet for us a bit and explaining what each of those letters stand for within this patient population? And also, I think, I typically say SGM a lot, sexual gender minority. So I think just kind of helping our listeners to understand and level set would be helpful as well.
Absolutely, absolutely. It definitely can be an alphabet soup at times. And yes, I love the phrase sexual and gender minority because it's just very all-encompassing. If we look at LGBTQIA+, that stands for lesbian, gay, bisexual, transgender, queer, intersex, asexual, and then the plus signifies that there are other identities that don't necessarily fall within the LGBTQIA portion. So this can include things like two-spirit and three-spirit, and the like. So it includes a whole number of different individuals. But I do love the phrase sexual and gender minority for just being that all-encompassing phrase.
Yeah, me too. Plus, it's quicker to say.
Exactly.
That's awesome. Thank you for that. So I would imagine when you are seeing SGM patients that taking a comprehensive sexual history is really important when you're assessing digestive health concerns. So curious about what that looks like and what information are you trying to gather in that history taking process when you're talking to someone with GI conditions?
Absolutely. Yes. The sexual health component and the sexual history component of the interview is so incredibly important. I think the important thing that I always like to say right off the bat is that I don't ask these questions just to my sexual and gender minority patients.
Thank you for saying that. I was just going to say that because my physicians ask me those questions as well, as they should. So thank you for saying that.
Absolutely. So off the bat, if anyone is coming in with a problem such as constipation, diarrhea, bleeding, rectal pain, anything like that, I'm going to get a sexual history. And depending on the individual, I'm going to go into more detail or less detail, depending on kind of the answers I might get to some of my questions. I think it's also important to note that you don't need to get a sexual history for every problem that someone might come in to see a gastroenterologist. For example, my patients that have acid reflux, I'm not going to be asking them necessarily about their sexual history because I would view that as irrelevant at best and kind of intrusive at worst and
Right.
inappropriate. So for me, whenever someone comes in with one of those chief complaints that I mentioned before, like constipation, diarrhea, or bleeding, I always like to normalize the conversation first and say, anytime someone comes in with the symptom that you're experiencing, I always like to get a brief sexual history. Is that okay if I ask you some questions? And most patients are going to say, absolutely. So the first question I always ask is, have you been sexually active within the past 6 months? If the answer there is no, then I kind of move on because the information I'm going to get is not going to necessarily be as relevant.
And just as intrusive at that point.
Exactly.
Yeah.
If they say yes, then I ask if it's with one partner or more than one partner. And after that, ask what gender the partners that they're sexually active with identify as. And that's just to be as inclusive as possible. In the past, and I can even remember back to only about, 6, 7 years ago, we were taught, oh, you should ask if you're having sex with men, women, or both men and women. But we also recognize that there is such a spectrum of gender diversity. So I just ask what gender their sexual partner or partners are. And then after that, the most specific question that I will ask is, do you engage in any form of anal intercourse? This can include sex toy use, and I may even go into more detail, going into more kind of a wider variety of sexual practices, depending on kind of what the chief complaint is or based on history that I am getting. And I won't go into too many of the specifics of that, but
Yeah.
I think the most important thing that I do is normalize the conversation that we're having and normalize the questions. Ending the conversation where it feels appropriate to end the conversation. So if someone says they're not sexually active, then we can move on. And just making sure to ask the appropriate questions for whatever that chief complaint is.
Yeah, I think that's great.
Yeah. Alex, you mentioned, there are certain symptoms that really prompt you to ask about sexual history. Obviously, constipation being one of them. And that's really relevant because one of our main interests in this podcast is, talking about irritable bowel syndrome and constipation. And so I just have a follow-up to that. When you see a SGM or sexual and gender minority patient in clinic who's there due to unrelenting IBS-C, what questions are you asking them that might be different from the questions you might ask heterosexual patients? Or are you looking into other factors like social determinants of health or emotional well-being, that might be particularly important to them?
It's a great question. I think, do I change, apart from, sometimes in the sexual history portion of things, I'm going to ask different questions, particularly for my patients that might be, men who have sex with men or something like that. I may ask slightly different questions in that regard. But in general, I actually have found that the approach that works best for me is being consistent across all of my patients. So, for example, getting that sexual history, I do try to ask a little bit more information about trauma as best as I can without, again, being too intrusive. I do just like to, normalize it and say, some folks in the past may have experienced things like physical trauma, sexual trauma, emotional trauma, and we recognize that impacts the GI tract in many different ways. So, just saying, if you're comfortable speaking about any trauma that you may have experienced, it might allow me to better care for you. For example, if I'm going to send someone to pelvic floor physical therapy for constipation, getting a trauma-informed history is really, really important because the last thing that I want to do is be responsible for re-traumatizing my patient. Similarly, even just with doing a simple rectal exam, I need to make sure that I'm not going to be causing more trauma as a result of that. So I would say for me, again, some small differences, particularly in the sexual history. But overall, I try to normalize all of these questions and try to ask them of all of my patients. Because if there's one thing that I've learned is that, you know, all of our patients do varying different things in their social histories and things like that. And it doesn't matter if you're straight, gay, lesbian, bisexual, does not matter at all. So I try to treat everyone as equals.
Alex, you're talking about topics and questions that are really sensitive and vulnerable for patients to disclose. And I would imagine that the best way to gather this information is through establishing trust first and foremost, right? And ensuring that your patients really feel safe in that disclosure. And so, before we go on to some of the other questions that we had for you today, I'd love to just dig a little into how you build that safe space and build that trust with your patients because, we talked to Dr. Staller a few months ago about trauma histories in patients and how that can really be a tricky topic to bring up with patients. And once you've brought it up, then what do you do with it, with the information? And so I'd love to hear from you, from your perspective, like how do you establish the trust and that safe space for patients to be able to be vulnerable and honest with you?
It's so crucially important. And, for me, I think the most important things that I do is the first time I'm meeting a patient, I always introduce myself, ask my patient what name they want to be called and what pronouns they use. Doesn't matter who the patient is. I'm going to ask all my patients that first and foremost, just to, show that I'm a friendly person and that, I'm happy to be taking care of them. And then I think the most important thing is listening. Far too often, particularly in my folks in the SGM community, they come to me and at the end of the visit, they say, thank you for listening because all of my other doctors just wouldn't listen to me. They would just make assumptions about who I am based on, how I present and things like that. And
Wow.
I think the thing that I've learned is that if you just let the patient talk without interrupting them and just let them go, it pays so many dividends down the road and it allows for a really productive doctor-patient relationship. And it really helps to establish that trust. I think I also try to do my best to partner with patients on whatever management plan I'm going to come up with so that it feels like it's not just me telling them what to do, but that it feels like they're taking ownership of their health and that, they're buying into it. And there are plenty of instances where I have, talked to patients and said, this is like some of my recommendations or things that I'm thinking about. Like, what do you think about that? And I have definitely had patients that have come back to me and was like, honestly, I don't really want to do that. And I say, okay, that's absolutely absolutely fine. And I tell people up front that, unless I feel like this recommendation is like, no, like I am truly worried about something, like it would be really irresponsible of me or us not to do this. Most of the time, I'm going to say, hey, I want to work with you and figure out what makes the most sense. So if it's hey, I don't really want to try medication, I really want to try diet for managing this, I'll say, okay, we could try that, absolutely. And then, in a few weeks or after a couple of months, we can reassess and see where we're at. And then maybe then we'll see if we need to make any adjustments. I think, again, treating everyone like they would want to be treated or like they would want their loved ones to be treated, listening, and then partnering with patients when it comes to the ultimate decision making. I think that's where I've been able to really build a lot of trust with my patients. And it's allowed me to, get more information in the history that I might not have been able to get without that.
Yeah, you bring up the idea of building trust with your patients, which is such a crucial factor in being able to drive effective communication and get the information that you need to help them with their care. And I think that's just so important. Trauma is one of the aspects that we've kind of talked about, and it is definitely a very sensitive issue. And then there may be other topics that could be considered sensitive as well, which may not necessarily be trauma, but even things like eating disorders or obesity. These can be sensitive topics as well, for all patients, but also for patients who are, SGM or who are of the LGBTQIA plus community. There's some data sometimes suggesting that these could occur at higher rates, that some of these sensitive issues do occur at higher rates in these communities. I don't know if you had any thoughts on that, or even just what resources might be available for support, if they're unique, or if they're kind of resources that you would share with everyone in general.
Yeah, absolutely. So, we know in the world of eating disorders that the sexual and gender minority community do have increased rates of eating disorders. And this isn't just anorexia and bulimia, but it's also things like binge eating disorder. And, so some of the sequelae of that, which can include low body mass index and malnutrition, along with obesity, metabolic associated steatotic liver disease, things like that. The data, we don't have the best pools of data for this. We do recognize that the most consistent literature is that there are increased rates of anorexia, bulimia in cisgender gay men. Thought to be related to this idea of, how am I presenting myself to the world? This idea of, masculinity and femininity and things like that. We do also have some data that suggests that bisexual and lesbian women have higher rates of obesity and being overweight. Again, thinking back to this idea of minority stress, feeling isolated, not having the social support system that they need to feel safe in this world. When it comes to resources, I think there are a lot of wonderful ones. Do I have any specific ones that I steer my sexual and gender minority patients to? Not necessarily. I will say that I view things like weight and body image as a multidisciplinary endeavor. So it's not just me in gastroenterology. I work with great nutritionists. There's GI psychologists, as well as just, psychology, psychiatry, and mental health providers that I think ultimately, particularly in my patients that do have disordered eating, that it's not just me that's managing them, it's a team of folks that's helping to manage what is going on. Within the sexual and gender minority community, mental health resources, I think the Trevor Project is a great organization. I also would steer people to the Human Rights Campaign as another organization that does really, really great work in this area. And at least here in Boston, we have Fenway Health as the largest LGBTQ healthcare provider, and many large cities around the country now have LGBTQ primary care providers that have a ton of resources, or at least more resources at their disposal that they might be more familiar with.
That's great. I I was thinking as you were talking about this eating disorder topic, and I've been speaking to patients. Actually, I spoke to 2 today, and I spoke with 3 on Friday. All IBS-C patients, all different backgrounds, and every single one of them have mentioned to me some sort of disordered eating that either they had in the past or that they are still really trying to get a good handle on. One of them being bulimia, one of them being anorexia, with full diagnoses of those conditions. And I just think that many times this topic of disordered eating and eating disorders is not really fully addressed within GI patients. And for those of us with IBS, food is the one thing we feel like we have control over. And so when we are feeling out of control with our symptoms, that is what we always look to try to fix our symptoms and modulate things. And I mean, I'm guilty of it as well, and ended up with somewhat of an eating disorder early on in my diagnosis. And Thank you for pointing that out, Alex, because I think that it's a good reminder for our providers who may be listening to really do a good assessment with their patients on their eating habits and how they feel about food. Because it's many times overlooked. And I think, particularly with constipation, you both can probably speak better to this. A lot of constipation patients are constipated because they're not eating enough fiber and they're not eating enough food in general. And so, a lot of it can be alleviated through assessment of their feelings towards food.
I 100% agree with that. And I think, we're recognizing more and more this diagnosis of avoidant restricted food intake disorder, or ARFID, where, patients are decreasing their caloric intake in an effort to avoid uncomfortable symptoms, whether GI related or not.
Right.
And I think,
which makes sense, right? Like that makes complete sense. If something hurts you, you don't want to do it anymore,
Exactly. And that's why one of the questions that I ask all of my patients is, have you noticed any changes in your appetite and any changes in weight that you've noticed, whether going up, going down, or the same? So I always make it a point to ask that question. So I could not agree more that getting that dietary history and getting that information can be extremely helpful.
Yeah. Andrea, what about you? How are you assessing that in your clinic?
Yeah, I think that this is a topic that probably went under-recognized or understudied for basically so many years. It's really mostly in the recent years that this relationship has kind of gotten the attention that it needs. And so it is really a growing area of knowledge. And yeah, as physicians, I think sometimes we're under-equipped to understand how to manage kind of the dietary consequences of IBS and similar conditions and the impact that that's having on people, not just mentally, but physically as well, through their food intake. I do always ask people about, very general questions about how they're eating. And it's pretty broad, but I just want to know, in their daily life, how much of that is occupying their mind. Are they, how much of their diet is impacting their day to day? And do they feel like they have a balanced diet? Do they feel like they're kind of maintaining good intake and good, nutritional quality? And I just kind of started off with that. But, the good news is there are, guidelines out now and expert guidance kind of giving some very pointed advice into how to screen people for disordered eating and how to give people very thoughtful, either diet or non-diet based recommendations depending on the person. So I think we're making progress, but it's definitely an important topic, for patients who already have added stress of, minority stress, of course, but for all patients across the board.
Yeah, that's really great. Thank you for sharing. Alex, I want to switch gears a little bit and dive into specific health concerns and considerations for transgender individuals, particularly those on hormone therapy and even having gender-affirming surgeries. And, what does that look like? How are you kind of assessing that, and what are those considerations?
Absolutely. So I will be upfront and say that a lot of this is just based on, in vitro, so in the petri dish kind of information that we have, as well as, just general expert opinion. And ultimately, we recognize on the hormonal side that the GI tract is impacted by sex hormones. So estrogen, progesterone, testosterone. How do hormones specifically impact the GI tract in humans? Well, that's a little bit less clear for us. Some of the information that we do have is that they can affect GI transit. So we recognize that GI transit can be altered in different hormonal states like pregnancy, postpartum, menstruation. We recognize that estrogen can affect the transformation of cells to produce more what we call pro-inflammatory cytokines. So increasing this idea of inflammation. We recognize that testosterone, on the other hand, may inhibit the growth of inflammatory cells. And one thing that I think is really starting to come up more and more is the impact of the microbiome and how estrogen and testosterone can affect the microbiome. Again, something that we're just in the infancy of understanding. So, can I target anything at this moment based on, whether someone's taking exogenous testosterone or estrogen? No, not now, but my hope is that in the future we will be able to. When it comes to another consideration, which is gender-affirming surgery, that's something that's a little bit more anatomic that we can think about. So all of my transgender patients, I do organ inventories. So basically asking them and saying in a very kind of, affirming way that, in order for me to best take care of you, I like to discuss any surgeries that you've had or gender-affirming procedures that you might have had, as well as what organs you do or do not have. Right. Are you okay with that? We go through and I ask them questions. And then, based on things, particularly in transgender individuals undergoing gender-affirming bottom surgery, whether that's to create a neovagina or whether that's to create a kind of like version of like a penis, that's where I can start having conversations about, thinking maybe more about pelvic floor dysfunction and thinking about, rectal sensitivity and things like that. I'm not going to give away too much, but there's going to be a great talk given by one of my colleagues at Digestive Diseases Week this year, exactly on this topic of anorectal manometry in transgender individuals and what our findings were, which I will tell you, spoiler alert, transgender individuals are way more similar to non-transgender individuals than we may have thought initially. But there are some unique considerations that we should be keeping in mind. Overall, I think really, really important. The transgender community has been even more stigmatized and even more discriminated against than other members of the sexual and gender minority community. So really making sure that we are, including them in research, including them in clinical trials, and, including them in everything that we're doing.
Absolutely. Yes, I have that talk marked on my calendar, so I plan to attend. Thank you for mentioning that.
Alex, I feel like hearing a lot of what you've been sharing today has been so informative. These are topics and questions that often, aren't part of the normal teaching curriculum as you go through training, in medical school or, any sort of medical training. But just in general, and you've created a special program for this, but just in general, what do you think, if you had to kind of give tips out there, what are some actionable steps that healthcare systems and individual providers could take to create, welcoming and inclusive environments for SGM patients and members of the community?
Absolutely. I think one thing that I've realized is when I speak about this topic, for a lot of folks, it does seem like doom and gloom, especially in the current world that we live in, unfortunately, with the rights of sexual and gender minority folks, constantly being under threat. But I do think that the reason why I have optimism is because there are so many people that want to learn more and want to do more. For me, I think it all starts with education. Many individuals are interested in learning about this and interested in gaining these skills and this knowledge. They just don't feel equipped, nor do they have individuals around them that they feel like can give them the teaching that they need. So I think education is hugely important. Myself, along with many of my other Rainbows and Gastro colleagues, are happy to speak. And in fact, we get a lot of joy in speaking about this topic with individuals who are interested in learning more. So I think education. I think collecting sexual orientation and gender identity information as best as possible. I think nowadays, with the current political climate, it's a little bit more of a touchy subject, and I always ask permission to collect that information for my patients. But I think it can be incredibly helpful to understand who we're taking care of. For having just a welcoming clinic environment. So, whether that's having a little Progress Pride flag on your name badge, whether that's having a Human Rights Campaign equal sign in your clinic space, whether it's just simply having a non-discrimination policy very clearly visible saying that we take care of all individuals, no matter their race, gender, sexual orientation, ethnicity, what have you. Those are some really great starting points. I mean, other things that I always mention, we're all going to make mistakes. I still make mistakes. And it's about understanding your biases, understanding that you will make mistakes, and when you do make those mistakes, to apologize and not wait for permission to apologize, which I think, unfortunately, we do far too often. And then I would say, most importantly, just treating our patients, whether they're a sexual and gender minority patient or not, just treating them like we would want one of our loved ones to be treated. Your parent, your sibling, your partner. If we boil it all down, I think we can all agree that everyone just deserves to be treated like a human being. And by doing that, I think we would make so much progress in this area, not just for sexual and gender minority folks, but for healthcare in general. And I think patients would really respond well to understanding that, we just being a nice person can really take you a long ways. So that's really the main things that I always advocate for.
Gosh, I totally agree. It seems like such an easy thing, right? Like, of course, that would be wonderful that we were all treated with dignity and respect, no matter who we are. Alex, this has really been a great conversation. Thank you for bringing your insights. As we close out the episode, curious about what you want to leave as like your final pearls of wisdom here regarding this topic.
Yeah, I think that for me, the main pearls of wisdom that I can advocate for is just what I finished with, which is, treating others as you would want to be treated or you would want a loved one to be treated, being open, asking the right questions, and ultimately listening, because your patients store all of that information and all of the important stuff inside them. So listen to them, and they will guide you to the direction that you need to guide them. So those would be my big pearls, and that, we're really excited about everything that is going on in the gastroenterology world, the work that you all are doing in the Gut Matters podcast, and in really pushing forward this work. So we really appreciate all of that.
It's our pleasure, and so excited that you were able to join us. Also, so proud to be supporting Rainbows in Gastro and all the work that that team is doing in research and publications on the data that you're gathering. That I think, to your point, is so important that we have SGM patients a part of clinical trials and a part of all of these different studies, because how can we improve care if we don't know what the needs are and where the gaps are?
So thank you, Alex, for sharing your input with us today, and all the insight and experience that you have in this particular topic, which is a challenging topic, I think, for a lot of patients, a lot of clinicians. And thank you for the work that you're doing with Rainbows and Gastro. And I'm sure if listeners are interested in gaining more information about this topic, there could be other resources that they could continue to access.
Absolutely. Some places that you can go. First and foremost, I would be remiss if I didn't plug rainbowsandgastro.org for more information on Rainbows and Gastro. You can see our kind of team members and the work that we are doing. Other areas, that we have. We're working on educational materials that will hopefully be out in the coming months to help target this area. I also always like to direct people to the Fenway Institute, who have great educational modules on caring for LGBTQIA plus patients and sexual and gender minority patients, and the Human Rights Campaign as some educational resources that have been very helpful for both me and many of my colleagues.
Thank you. Thank you so much, Alex. Look forward to reconnecting with you again in the future. And thank you, everyone, for joining us today for Embrace the Rainbow Digestive Health in the LGBTQIA plus community.